Thank you for joining us today. You're listening to the Beyond 50 radio program, and I'm your host, Daniel Davis. Joining us here on the Beyond 50 radio program today is just those sort of experts that are on the program. And today we're going to be talking about breast cancer and what we can do to try to help prevent that, because we know just how devastating it can be to family, to friends, and to the like. Joining us here on the Beyond 50 radio program today is Dr. Rebecca Glaser and also Dr. Catherine Retzler. Dr. Rebecca Glaser, thank you for joining us here on the Beyond 50 radio program.
Thank you for inviting me, Daniel.
You bet. Now, tell us about your background, how you decided to move into the career, if you will, or the lifestyle of being a medical surgeon as well as a doctor.
Okay. It's kind of interesting. I actually did training, my residency in surgery, in general surgery, and what happened was I just started doing more and more breast cancer cases, and eventually I specialized in just treating women with breast cancer and breast problems. So it just happened to me. It's what I became interested in. It's what I did research on. And after dealing with women with breast cancer, I started looking at hormone levels in these women, and that really kind of shifted where I went now and where I'm at today.
Now, can you explain the effects of various hormones on breast tissue? I mean, is that one of the concerns that may be causing breast cancer, or what's really going on there? And how come sometimes it seems that the message we get in mainstream media is the fact that, well, we just can't figure it out?
Daniel, that's a great question. I think the fact that you recognize that different hormones act differently on breast tissue is very important. I don't think doctors even understand that different hormones act differently on breast tissue. We know that estrogen stimulates breast tissue. That can be the Premarin, which is made from horse urine. It can be bioidentical estradiol. It can be synthetic estradiol, but estrogen stimulates breast tissue. What a lot of physicians don't recognize, though, is testosterone is a balancing hormone to estrogen. You can think of them as the yin and the yang of hormones. And testosterone, and I'm talking about the hormone that's identical to testosterone found in the body, actually prevents the stimulation of breast tissue from estrogen. So when the media talks about hormones, we think of estrogen in women, and they think that all hormones are bad or increase the risk of breast cancer, where we know that's not true. Testosterone, when you actually put it on breast cancer cells, it inhibits them from growing. And there's actually a study out of Australia where women that got testosterone implants or pellets as part of their hormone replacement therapy actually had a lower risk of breast cancer than women that didn't get the testosterone implants. So different hormones actually act differently on breast tissue. Part of the confusion is when the media talked about hormones, they're all lumped in the same basket, and I think we got to start saying, what did this study show? What hormone was used in the study? For example, oral synthetic methyltestosterone has been shown to increase the risk of breast cancer, but that's by various mechanisms. It may increase the risk of breast cancer by converting to a very strong estrogen that binds very strongly and stimulates breast tissue. It may also increase the risk of breast cancer by preventing testosterone from actually getting to the breast cell. So not all estrogens are the same, not all testosterones are the same.
And Dr. Catherine Retzler joining us by phone today. Doctor, you on the air?
I am now, finally. What a great opportunity to experience stress and try not to let it impact my body.
See, she practices what she preaches.
Exactly. There you go. Now, was there a bioidentical hormone that you had to deal with that was able to keep you from having a high stress
level? I'm sure
level?
It was. My brain kicked in, and I was able to problem solve. It was my testosterone.
Nothing like that pesky testosterone to get in the way of our egos. Now, Dr. Catherine, you've been listening to Rebecca. She was talking about the effects of various hormones on breast tissue. And one of the things that, I had addressed, and I don't know if you were listening as you were trying to get it, the testosterone can block your hearing sometimes. But
Good one, Daniel.
But, yeah, the point that I was trying to make is it seems like when you listen to the messages of breast cancer, it's like people seem so clueless, and these are supposed to be experts, like, we can't figure it out. And I guess part of why I asked that particular question is, are they doing that to stay elusive so people will kind of continue to go in their direction for a cure or whatever the case is, or is it really because, as Rebecca was saying, they just don't really know?
I'm not sure I understand your question exactly. Do you mean when doctors talk about breast cancer risk, or the media, or?
Yeah, the media, mainly through doctors. They're talking about this, but you get this feeling like they really don't know.
I think it's complicated, and I think there's a lot of fear involved, and whenever there's fear involved, there's going to be reactions.
Sure.
Are you talking about in terms of hormones in general, or?
Well, it's actually just, the question was, can you explain the effects of various hormones on breast tissue? And it seems that the message kind of seems confusing in such a way that you almost feel like they really don't know.
The information's out there, and I credit Dr. Glaser with putting a lot of that together and putting it on her website in an accessible form in terms of her PowerPoints and, the data she's collected. Certainly what happens is a lot of times in the media, when a study comes out, you'll see comments that aren't exactly complete in terms of what the results of the study were, or misuse of terms. For example, the misuse of the term progesterone when really they're talking about synthetic progestins. There's a difference between each hormone and its risk on breast cancer. There's a difference between what studies find, and then there's a difference between the way it's reported in the media. So there's room for a lot of confusion, and then add fear to that mix, and it messes everybody up.
Yeah, okay, there you go. I think you explained what I was wondering about.
But I think there is an interest in big business to keep the status the way things are, too. Mm-hmm. I think, Daniel, that might have been your other point, and I kind of agree with it.
Yeah, that was actually sort of what I was getting at. Yeah, they make it in such a way where, for instance, and again, we don't try to pick on that because people make choices that support those ways of doing things, but that you mix it, you muddle it up so much, then the main message people get from it, it's just like this, and so they follow that, and it's not really necessarily in their best interest to do so. And one of the things we try to do here on the program is really try to get solid answers from solid people such as yourselves, and so that's why I kind of took that question and softballed it a little more, as to kind of take an overall picture of maybe you should pay attention to what information you're getting and where you're getting it from, and really follow it up by backing it up with other ways of finding out what the truth is.
Absolutely.
Okay. Agreed.
Okay, so I guess we kind of went long-winded on that one. We were trying to smoothly get Dr. Retzler in here, I think is what it is, and get people to forget that she was having a hard time beating on the door. She's on her prison furlough right now, so we've got another 30 minutes with her. But now, what I'd like to get back to is the hormone issue. Now, what is the effect of testosterone on breast tissue?
That's a good question. As I mentioned a little bit earlier, testosterone actually can prevent breast tissue from growing. And there's some really great studies out of the NIH where they actually looked at primate or breast tissue, mammary breast tissue, which is similar to what humans have, and they looked at the effect of testosterone, and it did prevent proliferation. It did prevent the things like increase in estrogen receptor alpha, which increase the risk of breast cancer. So testosterone itself, non-oral testosterone, was shown to be protective of breast tissue.
And very importantly, we're talking about bioidentical testosterone, so the same molecule the body makes. That is
Correct.
Not true for
Thank
methyl
you, Kath.
testosterone. Yeah, we have to keep pointing that out over and over because, unfortunately, the two get lumped together when people talk about it.
Yep, and that really bothers me.
Well, yeah, because it leads to inaccurate conclusions. Yeah, it's actually a really big deal that the only FDA-approved medication for testosterone replacement for women in this country, unfortunately, is methyl testosterone, which is synthetic testosterone. Uh-huh. And that means that we turn to studies to hopefully back up what we're using by compounding bioidentical testosterone as an option for women in this country, because the only option is one that has been shown to contribute to, hepatitis and liver cancer in men, and it was taken off the market. It's still given to women in this country as methyl testosterone. That's the only option for women right now.
And that was the testosterone in the Women's Health Initiative trial that increased the risk of breast cancer, yet they referred to it as testosterone in the article.
See,
so that's why there's confusion, Daniel, because even the physicians writing the articles in the journals don't differentiate between the hormones. That's the same for progestins, the synthetic progesterone versus bioidentical progesterone. A lot of times they don't differentiate between the two molecules, and they do act differently in the breast tissue.
It's just kind of funny that, somebody can take such care in trying to treat someone or even in surgery. Very precise, you're focused, you're taking care of business. But yet once it comes out of their mouth or into an article, it seems to get real messy and cloudy, and it seems you would want to have that same kind of focus on what you're saying or writing about as you would when you're actually treating. And so why do you think that happens, that doctors kind of get confused that way?
Daniel, I don't know, because you think the people writing the article would understand that two different molecules can act differently at the receptor. Okay. I don't know why they are not more careful about that.
I think it's also a CYA. It's like, we talked on the show before about how we as physicians practice sometimes, from the standpoint of fear of liability instead of what's best for the patient. And so a lot of times doctors who do know the difference between the molecules, because they're practicing from that, as we call CYA standpoint, the cover your butt standpoint, they will say, well, since we know this about progestins, then all progestogens must have this effect. Because that way they've covered their butt, which isn't true, and the data doesn't support that, but instead of looking into that and being courageous enough to make that distinction, I think sometimes it's just simply easier to say all of it, which is the argument that a lot of doctors give about all estrogen replacement therapy is, quote, dangerous or increases breast cancer risk. And they just make, flagrant statements like that simply because it's easier than talking about, modes of delivery, bioidentical versus synthetic, and then duration of use. I mean, there's so many other variables, but it's easier to just say, don't do it.
Mm-hmm.
Okay, so let's take a look at somebody who may have the early stages of breast cancer, or we can actually go both ways. Somebody who's in the early stages that wants to be treated, and then somebody who just simply wants to take the right steps for prevention. Okay, so what sort of questions would a person like that want to ask, and what sort of information is the most important for them to get their hands on so that they make good and right choices for themselves versus being bombarded with a bunch of fear tactics, as you talked about earlier in the program, and actually facing it with courage and saying, okay, I feel encouraged because I know that I am armed and ready for this whole thing?
I think that's a great question again, Daniel. I think people need to go to a practitioner that understands the difference of the effect of different hormones on breast tissue. I have treated thousands of breast cancer patients, and I actually do treat breast cancer patients with hormone therapy, and I also feel that I treat my other patients that don't have a history of breast cancer with very safe hormone therapy. One of the things that I do is say, what's the safest way to give estrogen? What estrogen is the safest and the least stimulatory to the breast tissue? Well, I think there's data that supports that estrogen delivered vaginally, in particular estriol, does not increase the risk of breast cancer. There are huge trials that show that vaginal estriol does not increase the risk of breast cancer, even in breast cancer survivors. Yet people are continuing to say there's no data on the safety or efficacy of vaginal estriol. That's simply not true, and the safety data is clearly there. In fact, vaginal estriol is used over-the-counter in Europe. The other thing I do is I give a lot of progesterone vaginally and even estradiol vaginally, and I think it's a very safe route of administration. In breast cancer survivors, the only estrogen I use is vaginal estriol. But I also treat them with testosterone and sometimes progesterone, not the synthetic progestins. The synthetic progestins have been clearly shown to increase the risk of breast cancer. Not vaginal progestin in the IUD, but the systemic synthetic progestins have been clearly shown to increase the risk of breast cancer. On the other hand, bioidentical progesterone in a large study out of France was clearly shown not to increase the risk of breast cancer, and that was a head-to-head trial looking at progesterone versus the synthetic progestins. But like Kath says, there's still organizations, there's still top people who are often funded by pharmaceutical companies that claim there's no difference between progesterone and the synthetic progestins. But when you're looking at hormone therapy in breast cancer survivors, you want to do something that's not going to increase the risk of breast cancer recurring. And I think I've got data to support what I do. I also ask the oncologist opinion, and I want to get them involved, because the worst thing you can do is put a patient between you and the oncologist. But these patients have severe symptoms sometimes, and they get tremendous relief with vaginal hormone therapy, including testosterone either as in the vaginal cream or as a pellet implant. So I think you've got to look at the patient and say, what's the safest, most effective hormone therapy I can offer?
Mm-hmm. I totally echo that, and I think something that Dr. Glaser was, inferring is that, when your patient comes to you, whether or not they have a history of breast cancer or have been recently diagnosed, it's really important for them to know the facts, the risks and benefits of everything that they're using and all their options. And unfortunately, that cannot be covered in a 6-minute appointment. So,
that's for sure.
I have to spend an hour and a half with each patient, and every time I try to lower that time, I just can't get through what I feel like I need to get through. And then we send them a lot of information in advance. We encourage them to write down their questions before they come in. Maybe have a friend, especially if they've been recently diagnosed, because they may be at a point where they're kind of scared and they need some support. And, go over all the risks and benefits with that particular patient. And I treat breast cancer patients a little bit more conservatively than I do people who just want information and don't seem to have as many risk factors. And I talk to them about risk factors. Are you aware that, your obesity is a risk factor? And I know we're going to talk about hormones, but I also want to talk about the fact that we need to help you lose some weight so you can lower your risk in that way. Or, are you aware that even though your cardiologist says to drink 2 glasses of wine a night, you really don't have an alcohol deficiency and you may actually be increasing your risk? So, I talk to them about these things that they're doing, and we don't just focus on the hormones,
Right. Mm-hmm. Absolutely, Kath. I talk to all of them about diet, and particularly getting the sugar out of their diet, which cancer cells love.
Mm-hmm.
Yeah, there's sugar. There's also the white flours, the bleached flours that we seem to always have in our diet.
Correct. Yeah, right.
It's just really interesting how, especially I was just talking with a producer the other day about, you see all these nutraceuticals that are out there, these berry juices, so forth, and everybody's claiming about, it's reversing all this. And I thought to myself, if they just simply detoxified themselves, they would find they probably would feel way better right off the bat without having to buy anything. You just kind of change, as you were saying, Catherine, as you just simply change your lifestyle, get away from what you're doing. Doctor says 2 glasses of wine, you say, hey, you don't have an alcohol deficiency, so why have the wine in the first place?
Right,
and it's
exactly.
Just,
great.
You watch
yeah.
the messages so much being volleyballed, it's like you get to a point, what are we supposed to believe and do anymore?
Oh, right. Exactly. Low-fat diets. Nothing could be worse for the population.
Right.
Crazy stuff. Now, is it possible that hormones can cause breast cancer? A lack of or too much?
I think
that's a loaded question.
I think an imbalance in hormones out of balance, can contribute to an increased risk of breast cancer. I think if you have too much estrogen, we know that stimulates breast tissue. And I'm not talking about vaginal estriol because that doesn't stimulate breast tissue, but if you have too much estrogen, and that includes insulin, do you know what I mean? And estrogen's in our environment. That's very stimulatory to breast tissue. If you don't have the balancing testosterone and phytonutrients, that can contribute to an increased risk of breast cancer. Synthetic progestins clearly have been shown to increase the risk of breast cancer. A single study shows that oral synthetic methyl testosterone increases the risk of breast cancer. So I think there's a difference between the effect of synthetic chemicals on breast tissue and actual hormones. But even bioidentical estradiol, out of balance, stimulates breast tissue and can increase the risk of breast cancer. And that's where you get physicians saying, well, there's no difference between synthetic hormones and bioidentical hormones. They're only looking at the very strong estradiol, comparing it to Premarin. But there is a big difference. There's a difference between progesterone and synthetic progestins. There's a difference between testosterone and synthetic oral methyl testosterone. And there's a difference between vaginal estriol and oral estradiol or topical estradiol, which is very stimulatory to breast tissue. So I think you've got to look a little bit deeper than these blanket statements being put out by these organizations.
And that sort of seems to be the problem, too, is that everybody takes a blanket statement and they don't even ask the question, well, is there more to this?
Bingo. Doctors don't even ask a question.
Strange.
Yeah, it's not about balance anymore. It's about, one risk factor that we all go crazy over, and we really lose sight of the entire, situation, which is hormones in balance are breast protective. Any hormone out of balance doesn't make sense. You wouldn't find that in a human being. So why would you give a woman high doses of, topical estradiol or high doses of other hormones without balancing the hormones that may be out of balance? It doesn't make sense. intuitively. And yet we do studies looking at one hormone or another hormone and a synthetic version of that hormone that you would never find in a human being, and we're surprised at the results. I mean, really, you could get pretty fundamental about it.
Mm-hmm. For those of you joining us today, you're listening to the Beyond 50 radio program as we talk about breast cancer, how to prevent it, and how to treat it in a very safe and natural way, and most importantly, how to really cut through all the blanket red tape stuff that we hear out there about the one-size-cures-and-fits-all, and how we can find out going about getting the right information and do the right thing. And our guests joining us here on the program today, Dr. Rebecca Glaser and also Dr. Catherine Retzler, both experts especially in the field of hormone therapy and replacement. Now, that's the interesting thing that you were talking about, Rebecca, is the fact that you see a message that is that silver bullet. But then what's been really interesting that I've found over the years is now when you're seeing these commercials, they start listing all the side effects that they may have, and I really am starting to feel encouraged about how the message is coming out. Why in the world would you take something that allegedly will treat something you weren't aware that you have and then suffer all the side effects to be sure that that one thing that you were getting this for in the first place is going to be eliminated? And I think that that's the kind of common sense that the listeners should approach this whole thing with. Would you agree with that?
Oh, absolutely, Daniel. And it's one of the things that probably upsets me the most is over-medicating seniors. And then
oh, yeah.
Oh, my gosh, and the side effects they have. I had a friend whose father was diagnosed with Alzheimer's disease, and he went into the hospital, and he was in heart failure and kidney failure and liver failure, and they made him what's called a comfort measures only. They knew he was going to die. This poor man had Alzheimer's for 2 years. The mom had taken care of him, and they made him comfort measures only. They stopped all his medication and just made him comfortable. Guess what happened, Daniel?
Couldn't imagine.
He was fine. He woke up. He knew everybody. His brain was totally there.
He
died 6 months later, but here's this mom. My friend's mom took care of him as an Alzheimer's patient. She lost her dad for those 2 years. But it's not just that. These seniors are put on medications. Over 50% of people put on a medication, that medication doesn't work in them, and they don't stop it. They add something to it, or like you said, Daniel, they treat the side effect of a medication, but nobody's more susceptible than seniors who believe doctors.
Well, yeah, because this is a time in their lives where they realize time is now on the horizon, unlike when we're in our teens and 20s where we just feel like we're invincible and can go on forever.
And we are.
But we probably true, too, especially if you're at hormone balance.
That's right.
But, you know, just the fact that, you know, they're concerned about their health, they want to keep going, so they're going to listen to the doctor's fact. But I remember years ago being in school, and it was profound what a teacher had told me once, and it was just interesting because it made me kind of look at doctors in a different way, is that they're trying their hardest to do what they do. They're really dedicated and committed to trying to help and heal. But at the same time, they're just like anybody else. They're taking an educated guess as to how to do that.
Mm-hmm.
Right.
And now they're being trained by pharmaceutical companies.
Right.
Mm-hmm.
And that's really sad.
That is really sad. I mean, that's where a lot of doctors get their continuing education. I think it's a generational thing, too, what you're talking about, in that women I see and baby boomers are highly educated. They've got the Internet. They read. They're more assertive. Some of my, elderly patients, for lack of a better word, the wiser ones, the older ones, they don't know that it's okay to ask questions.
Right.
And they're obviously they have the same intelligence. It's just that they were kind of brought up to just have respect for the doctor and do what they say instead of recognize, that we're human beings and we can talk about things, and they have the knowledge or the intelligence to understand their own bodies. So that's hopefully changing in medicine. Doctors are becoming better teachers instead of just the authority figure who tells you what to do. And
right.
Patients are becoming better knowledge seekers instead of just the recipient of, whatever the doctor says. So that's hopefully changing. But I think what you're talking about in terms of the seniors is generational too, which is unfortunate.
Yeah, it's just really interesting to think that we are taking, it's a complete paradigm shift to the fact that people are taking more responsibility for their health and using the doctor as more of a coach. And it seems that, as you were talking about earlier, Catherine, this ideal of liability, that people are just going sue happy because the doctor maybe made a mistake. Well, the point is, Well, if you're going to work with them, maybe you can just draft up a statement that says, I have completely decided to do this, understanding everything that I'm doing, and I'm not going to hold the doctor liable if something bad happens, which it probably shouldn't if you guys are on the ball with your information. Now, I was going to ask you, now, you were saying earlier in the program that doctors claim there is no difference between bioidentical hormones and synthetic hormones. What's the light on that?
Well, it's not true.
Testosterone.
I like your answer, Kath. Kind of right to the point there.
And this is part of the reason I put on these crazy 3-hour seminars to educate patients, to give them the research, to explain the differences to them, so that if they're told that by their doctor, they can be armed with information. And again, I try to take the standpoint that it's not, those using bioidenticals against bioidenticals. It's more that we're all in a process of understanding and learning, but let's hope we all have the same information. And sometimes it's a lack of information that leads to that reactionary, there's no research, there's no data, or it's all dangerous type, response. But, when you're talking about estrogen, you have to look at each hormone separately, whether or not it's going to increase the risk of breast cancer. When you're talking about estrogen and bioidentical estradiol, as well as synthetic Premarin, as well as possibly the synthetic estrogens in hormonal contraceptives, and you're talking about breast cancer risk, there have been studies that have shown increased risk with bioidenticals, just like studies showing increased risk with Premarin, or especially PremPro, since Premarin itself in the WHI didn't show an increased risk. But you have to look at each hormone separately. The same is true for, as we've been going on and on, the difference between progesterone and progestins, and the difference between methyl testosterone and bioidentical testosterone. So there's absolutely a difference between synthetic and bioidentical hormones.
And you know what? There's also other differences between progesterone and the synthetic progestins. Their effect on heart and blood vessel and brain function. Progesterone is brain protective. The synthetic progestins increase the risk of dementia. Progesterone is absolutely necessary to maintain a pregnancy. The synthetic progestins cause abortions. So,
that's a really good point.
There's a lot of differences between progesterone and the synthetic progestins. Not just the difference in breast cancer risk.
So, if somebody's going to the say the pharmacy and they see this sitting on the shelf now, are those kind of things available over the counter?
Bioidentical progesterone is available over the counter. But, estrogens and testosterone certainly aren't of any form.
And bioidentical progesterone is available as prescription Prometrium, which is FDA approved, which is a product actually that began in Europe. So it's not about FDA approved or not, or bioidentical or not. They all overlap, like Kath said earlier. It's not us versus them, for goodness sakes. I use a lot of Prometrium in my practice.
That's a good point, actually, Daniel. We should really underscore this. A lot of times the word bioidentical is being misrepresented or defined in a way that Dr. Glaser would not define it. It's being defined a lot of times as a topical mixture of hormones that's made at a compounding pharmacy. This is not the definition of bioidentical. The definition of bioidentical should be, in my opinion, based on the molecular structure of that hormone. That is what's most important. So, for example, a lot of times you hear people talk about, quote, natural thyroid versus synthetic. All thyroid hormone is bioidentical thyroid hormone. I don't care where it comes from. It's the molecular structure of that hormone and whether or not it fits its receptor exactly. And so when we're talking about bioidentical progesterone, for example, there is bioidentical progesterone available in creams. There's bioidentical progesterone, as Dr. Glaser pointed out, as Prometrium. You can have it compounded in a sustained release format, especially if you're allergic to peanuts. But it's very different in structure than progestin. So I don't care if it's made by a compounding pharmacy or if it's a pharmaceutical drug, as long as the molecular structure is the same. And then we talk about dosage and delivery method. But just to differentiate, that is the true definition of bioidentical, not whether or not it's made in a compounding pharmacy.
Thank you, Kath. That's a good point.
Very good point. Now, I was going to ask, just picture now as people are listening to the program here, that maybe they know somebody who is getting the onset of breast cancer now. Step by step, how would you, and just this can be like a virtual way of doing things, but maybe through what you'll explain, it'll help people understand better how they can walk their path and do the best thing that is possible for them, instead of buying into the way of feeling fear. Well, if you don't do this now, then this is going to happen. So forth.
Oh, that
so
is
how
so
do you
true
like
in
to
cancer therapy. The fear factor. You pegged that one.
And the thing about it is now, how do you like to treat people who may have a history of breast cancer with hormones, and how do you treat? What is your treatment process if somebody comes through your door?
Well, if someone comes to my door,
now, I know it's going to be different for everybody. I understand that, but this is a way that we can kind of comb this out so somebody can feel more confident rather than moving into a fearful direction, maybe making some decisions they shouldn't be, that they're moving with confidence.
Right. When they come through the door, I mean, first and foremost, it's not here's your magic hormone and this is going to prevent cancer from coming back. I talk to them about their health, and just like Kath mentioned, we talk about diet. Stress is a huge risk factor, especially for premenopausal breast cancer, and that's something I've seen in 15 years of taking care of breast cancer patients. Real hard to prove in a study. But so we talked about diet, stress reduction, what's going on in their life, but then I do look at hormone levels, and I do see if they're out of balance. We talk about estrogen dominance, and we talk about balancing their hormones. We look at symptoms in these people just like regular patients. They're no different. And if they have bone loss, memory loss, confusion, low testosterone, then that's something that is going to be helped by testosterone. But you've got to make sure the oncologist is on board with that. And most oncologists, believe it or not, are bright enough to understand the role of testosterone in breast cancer patients because we used to treat breast cancer patients with testosterone and testosterone pellet implants. So most oncologists actually are okay with the way I treat breast cancer patients. They also know me, and they know my history of taking care of breast cancer patients. So to treat a breast cancer patient, I do look at their symptoms. I do look at their hormone levels, and then I treat them. But again, if I treat a breast cancer patient, I use vaginal estriol and progesterone and sometimes testosterone in that vaginal cream, and they use it 3 days a week. The reason they use it 3 days a week is because that's what's been shown in studies, not to increase the risk of breast cancer. In fact, the people that were treated with vaginal estriol in DO study, that's the name of the author that did the study, they actually had a relative risk of recurrent breast cancer of 0.7, which is lower than the people that didn't receive treatment. So I have very specific ways I treat breast cancer patients and very specific hormones that I use, but they are all bioidentical, and they're all given in the safest way I see possible. And I think when you balance the hormones, these women are actually going to be healthier women, and they're going to have better immune systems, and we're going to see a lower recurrence of breast cancer in these people treated. It's a tough decision because if anyone goes on hormones, they're all going to say, oh, that's the reason I got my breast cancer back, but that's not true. And that's what I have to live with, and that's what they have to live with.
I think it's important, as Dr. Glaser said, too, to make sure that patient has a team because one person cannot cover everything. And, I look to the Cancer Treatment Centers of America for a lot of information about complementary cancer care because they're the only integrative cancer center doing actual integrative research while they're treating patients in an inpatient setting. So they've got oncologists on board as well as people who are specializing in, psychoneuroimmunology, which is basically helping patients reduce their stress and access their own body's healing mechanism through relaxation. And I looked to the CTCA for some of their data about melatonin, for example, and they're using 20 to 40 milligrams of melatonin to help inhibit breast cancer cells from growing, which has been shown, in a petri dish and hopefully in the human body. And we know that women who work at night have a higher risk for breast cancer. So there seems to be some reasoning behind giving melatonin, which is a pretty potent antioxidant, to patients. And we talk about other therapies like green tea and indole-3 carbinol and fish oil and antioxidants. So we go through their entire supplement regime, hopefully streamlining, because a lot of times they're coming in with shopping bags full of things they've bought off the Internet.
Oh, yeah, that's so true.
Well, I was just thinking, too, Catherine, is the fact that when you said something about antioxidants, the first thing that flooded my mind is all these products out there that give you more antioxidants than ever before. And so, I've got to have more of that. I think that's a good amount of that to do whatever it is that they say. And if you really listen to the message, they say this does this. It's like watching Fox News. There's no real facts. They're just sort of hinting that maybe this happened. They're not saying that it did. And if you pay attention again to the messages most clearly, then you would realize what the right common sense steps are to take. Do you feel, either one of you can go with this answer here, Is there a lot of common sense in there when it comes to following, a procedure that could help?
Obviously there is. I mean, you can always find conflicting research. If you look at antioxidants and cancer risk, there's certainly conflicting research in terms of which antioxidant, what dosage, et cetera. But you can't go wrong with food. So we
good food, whole food. That's right.
What is your diet? What are you eating? Not what pills are you swallowing? So, looking at the basics is common sense. Do you exercise? Do you manage your stress? And do you eat well?
Right. And you know what? There's not a magic supplement, and I wish there was. I really wish there was that magic supplement. But you know what? The whole flaxseed is better than flaxseed oil. They act differently. Do you know what I mean? But you see people chasing the magic supplement. And you have this article that makes it sound like the greatest thing in the world. But you know what? I haven't found it. Have you, Kat?
I haven't.
I mean, I wish it's there. I really do.
It if I found it.
Well, most of those articles are coming from people who are in creative writing classes that want to work for the Inquirer, I'm sure. So.
And sponsored by the company selling the supplement.
Yes.
Yeah,
and that's what you got to look at.
When you look
at something through certain magazines, look if there's a vested interest.
Well, that's the point I was going to make, because I remember watching or reading in one magazine, and it was about the new health savings accounts. Okay.
Right.
And through the article, there was one particular company that they were pointing on, and finally, and this was the big aha moment, that you turn the page and there's a full-page ad for the company they were just touting in this particular article, and I thought, well, there's some bias
that sounds like a medical journal. That sounds like a medical journal.
Really. That's interesting. I think we should use our health savings account for our food, our organic produce, and our gym membership.
No, there you go. There you go. A wellness program. Well, that's what a lot of those are actually.
And our testosterone pellets.
There you go.
Okay, so now we've talked about how to balance hormones, the difference between bioidentical and synthetic hormones, the ideal that stress, you say, plays a huge level. And I do remember reading in several books that and this quote was always in these particular health books on how to improve your health, live better, and blah, blah, blah. But they would always say that doctors were quoted as saying that at least something in the neighborhood of, say, 97 or 96% of the people that go to the doctor for being sick are there really because it's stress-related, that it really doesn't have anything to do with a physical thing. It's more of a stress thing. And take a look at today when you realize the toxins that we see that are just everywhere. It's like you can't get away from them, especially when you live in a city. You've got electromagnetic toxins coming through the wires. You've got cell phone towers going up everywhere. We even had a gentleman, a German expert, who was talking about how you can heal your brain, saying that Portland, Oregon was one of the most toxic cities pretty much in the world because of all the cell towers, the cell phone towers that the city has, but yet it's also been the same city that was touted in green magazines as being one of the most green and sustainable cities at the same time. And you think, okay, what are we supposed to do now, But how with this bombardment of stress and toxins and the lifestyle probably is easy to change. I don't know how many people, for instance, in Portland really want to give up their 2 glasses of wine, but if they're willing to, what are some of the other things we should talk about here so that people say, well, what personal responsibility am I going to take so that I run this course and I become healthier and even move into an area that I can be in prevention? And I know that that's where you two come in. So the idea is not to treat it once it's there. The idea is to treat it before it happens, and just imagine how much better your life would be.
Yeah. And just, for the record, I do not drink 2 glasses of wine a night.
Oh, that's fine.
But I will say, certainly prevention in terms of, doing a yearly detox, eating well, exercising, and managing stress is the most sensible approach to any health condition, whether we're talking about breast cancer, cardiovascular disease, diabetes, et cetera, et cetera. I mean, it is so much easier and more cost-effective to prevent these conditions than it is to treat them.
Oh, my gosh, yes.
Mm-hmm. Prevention is always key, that's for sure. Now, talk about some of the environmental toxins. I know that we talked about, for instance, I was talking about cell phone towers, but what are some of the other toxins that people just may not be aware of that are creeping in and seeping into the body that can cause problems?
This could be a show in and of itself because it's, there are people who are experts at this. I talk about the organochlorines in my seminar, the chemicals that are known to be what we call xenoestrogens, which means they impact the endocrine system, and they tend to be estrogenic, although not like taking a bioidentical estrogen in terms of their activity. And there is research linking organochlorine levels in the serum and breast tissue of breast cancer patients. Now, there's also some studies that show no increased risk. So this kind of thing is hard to prove because we're all exposed and yet we don't all develop breast cancer. On the other hand, we know that some people are born with genetic detox packages that are not optimal, and they may not be able to get rid of some of these chemicals that are known endocrine disruptors, even if they're exposed to the same level that we are. So I think it's a fairly big concern, actually, the amount of pesticides, PCBs, the xenoestrogens that we have in our environment. I think it is a big concern, and that's why I really promote people to do a yearly detox, because you're at least avoiding exposure to those things while you're doing the detox and hopefully enhancing your liver enzymes in getting rid of some of those toxins that can be stored in fat tissue, and breast tissue is mainly fat tissue. So, there seems to be a link. It's a hard thing to prove. Some studies show there is, some studies show there isn't, but I think it's safe to say avoidance makes sense and detox makes sense.
So what if you detox 2 or 3 times a year?
Well, we're going to be talking about that, I think, at 1:30. But, I came from naturopathic school, so everybody's always detoxing there. And I ruined my metabolism through thinking that I was continually toxic. So you can definitely go overboard on the detox mentality. And certainly some forms of detox are safer and healthier than other forms. So, listen at 1:30. I think we're going to talk about that, right, Daniel?
I believe we are, yes.
So we'll talk about that. But, yeah, you can 2 to 3 times a year is too much. And,
okay.
That's kind of going overboard. Yeah.
Well, I guess the final question that I have, because we've been talking also about people going and buying things off of shelves, the idea that they have access to being able to get these things without having to get a prescription. Are there any natural supplements that can help decrease risk? Because there's a lot of that touting going on out there, and so it's kind of like removing the whole muddy picture of, well, what is good and what isn't good, just as I was talking about earlier with the antioxidants. So are there any natural supplements that can help decrease the risk, and kind of give us an idea what some of the better ones are, and not from opinion, but, from an actual factual point of view?
Let me just address the issue of over-the-counter progesterone cream, because there is a feeling that progesterone is a very breast protective hormone, and I don't think that a lot of data supports it. There is certainly some data that supports that cyclical progesterone, giving it 10 days or 12 days a month, may decrease breast proliferation. What I don't want to see happen is people going out and buying over-the-counter progesterone cream and using it every day. It can build up, and we don't know the effect of continuous progesterone on breast tissue. So I think it's you need to know what you're doing. As far as supplements, I don't think there's enough data supporting that one supplement's going to prevent cancer. And I know
I think so. There is data, showing that indole-3 carbinol can be helpful to prevent breast cancer risk. I mean, there's quite a bit of data on that. But of course, eating broccoli is going to be even more helpful. But indole-3 carbinol comes from cruciferous vegetables and can help with the metabolism of estrogen. So, that seems to be a useful supplement. And green tea, of course, has been shown to help prevent several different types of cancers. So that's, it's not really a supplement. I prefer to see people drink it. But there isn't a single supplement that has been shown. But, certainly it makes sense to supplement with a reasonable dosage of antioxidants, fish oil, which frankly I think everybody in the population needs for brain health, hormone health, and otherwise. And to balance all the arachidonic acid in our diet. But green tea and indole-3 carbinol are the two that I usually tell people to increase their consumption of, at least, cruciferous vegetables and green tea, drinking green tea. But can I say something about the progesterone too?
Sure.
The over-the-counter progesterone is considered a low dose. However, I frequently see women bathing in it and dosing their children and husband because, of course, they're on it, so now everybody in the house is getting it all over. And that is a concern. It's a hormone, and just like DHEA is a hormone and is available over the counter, and I see people coming in with acne, and I've seen men come in with BPH associated with their conversion of DHEA into estrogens. So just because something's available over the counter doesn't mean it's safe. It just means that, unfortunately, it doesn't fall under the FDA need for approval before it can be sold. So, progesterone is a hormone, just like DHEA is a hormone. It doesn't mean everybody should be using it every day, especially in high dosages. And high-dose progesterone, besides being a concern in terms of breast cancer, can also possibly increase uterine fibroids because, we know that if you already have uterine fibroids and they're large, progesterone can stimulate one of the growth factors that makes them larger. I have seen this happen, unfortunately. So, it is a concern. So it does make sense to kind of talk to a doctor who knows what they're doing before you go applying hormones to your body.
Well, I was just about to say, so listen up, folks. Don't go out there and listen to commercials and think that you're armed with the right wisdom and experience, especially the knowledge that you need to go out there and do the right thing. Get together with a coach, or even as Dr. Catherine Retzler said earlier in the program, build a team. I mean, this is a team of people. That way you get several insights into what's going on, a more holistic point of view about how to create a treatment plan that both moves you into the path of good wellness and also the path of prevention as well. And it's been a pleasure to have both of you on our program today to kind of open our eyes and ears up to what the messages are that we should be kind of screening and avoiding and taking the right steps into moving toward getting that team and the right doctor that's a coach that can help you move in the direction that you want to move toward better health.
Thank you, Daniel.
Thanks, Daniel. Does that mean our interview's over, or do we have some questions to take?
No, so far that's just about it. I actually had one question from a guest here that says, how many glasses do doctors drink a night?
Becky?
Well, I certainly don't drink every night, and, I drink once in a while. Kath, you've seen me drink. I've seen you drink, so Catherine's a hoot on a glass of wine.
Well, we want to
know
thank
how to have fun. Having fun's important for your immune system.
Absolutely.
And then we really talk a lot.
I'll bet.
Like you wouldn't get a word in edgewise if we had a glass of wine, Daniel.
Well, we want to thank both of you for allowing me to at least have a word in edgewise during the program here today. The testosterone was held at bay, and so we were having quite a bit of fun here. But it's really good to be able to do a show where people can actually say, I never thought about that, or why aren't they talking about that? Get them to start asking the hard, important questions, because in the end, you're the one that has to live with the decision that your doctor helped you make. And if you're not feeling good about it, maybe it's time to find another way to go about getting yourself taken care of.
And you know what? There's nothing wrong with you asking your doctor why not. I mean, I've had so many women told, you can't do hormones, you have breast cancer. And I think these women need to say, why not? Where's the data that supports that statement? Do you know what I mean? Dr. Glazer's willing to give me data. Where's your data to support your side of the statement? Because these women are so undertreated, it really bothers me.
Yeah.
Well, again, thank you, Dr. Rebecca Glazer and Dr. Catherine Retzler, for joining us here on the Beyond 50 radio program today, and we'll look forward to your next talk as we talk about the right ways to detoxify and feel good. And thank you for being on the program today.
Thank you, Daniel.
Thanks, Daniel.
You bet. We want to thank you, the listeners out there, for joining us here. You've been listening to the Beyond 50 radio program, and if you want to find out more about us, just go to our website, beyond50radio.com. That is 50 with a 50, beyond50radio.com, and sign up for our free weekly e-newsletter.